Hey guys, it's Lily. Welcome back to the channel. I know it's been so long. I am so sorry. Rotations have been really crazy, but I really do hope you guys enjoy this video that's coming up. I had the privilege to interview Dr. Carl Lambert. He is a family physician at Rush, and he was able to share his story of getting through medical school, of getting through residency, and it really touched and inspired me personally just because I am getting through rotations right now. There are a lot of things to kind of figure out with rotations. There's a layer of just being a medical student, which is already a struggle on its own, and then you're also a minority student. So there are a lot of things to just try and figure out. But I really do hope you guys enjoy this video. Be sure to share it with others to inspire others, and also like, comment, and subscribe as usual. Leave some comments below on how you've been inspired or share your story below. And I hope you guys enjoy this video. Also make sure to click the notification bell so you can get notifications whenever videos come out. All right, I'll see you guys soon. Enjoy.
So my name is Dr. Carl Lambert. I am a black male physician. I'm a black man with a white coat. So yeah, I'm a board certified family physician and practice pretty much full spectrum care except OB right now. And I work at Rush University Medical College where I wear a variety of hats. So still a practicing clinician, a busy practice of 6 docs here. The other half of my time is spent teaching in the medical college. I teach all 4 years of medical school, whether that's at the bedside or doing clinical reasoning. I'm in the faculty advising program for our medical students. I'm faculty advisor for SNMA, which is really our main group to facilitate and increase representation of minorities, specifically black students on campus, is to make sure that their voices are heard and that they start and finish school on time. At my practice, I'm the medical director, which is keeping me busy. And I sit on the admissions committee here at Rush, so I'm really fortunate to be able to sit on a committee that takes a pretty holistic view of applicants to increase our representation in our student body. My journey to medicine, okay, started when I was a kid. I'm the oldest of 3 kids, 3 boys, so I'm the oldest. 2 younger brothers with autism, so at a really early age, I found myself and my family going to the doctor's office. And I found myself really interested in how doctors interacted with families. They seemed so smart. They seemed very relational. So there was that piece where at an early age, I kind of learned almost like how to be like a third parent and to care for people who could not care for themselves. So my middle brother, he is nonverbal. My youngest brother, he does sign language. So pretty much not knowing it, I was learning kind of like some of the stuff that you have to do to be a doctor. Like you have to be an advocate for other people. You have to be empathetic. You have to care. You have to kind of step in the gap to meet the needs of other people. So there was that piece. And then my dad, he is special. He likes thrift stores. So he would take me to the thrift store a lot when I was a kid. And he would be looking at the clothes department where I would go to the books. So I would always find different books that interest me. And there was this Charlie Brown book with Snoopy on the cover, and it was about anatomy. And I just could not put this book down. I begged him to let me have it, and I took it back to the house. I read that thing hundreds of times, and not only did I read it, but I had stuffed animals in my house, and I would pretend to teach the anatomy to the stuffed animals. So there was something that was going on at an early age where I knew I liked science, I liked the human body, and I liked using that knowledge to help other people who could not care for themselves. And somewhere along the line, I realized, oh, that's kind of what doctors do. You heal people, but you also get to teach. You get to be an advocate and care for patients. So I knew that early on, but the question was like, how do I get there, right? Thankfully, for most of my I guess career, I've been surrounded by people who I felt believed in me and made me feel like there wasn't anything that I couldn't do. Even though I was a black male, it wasn't until I went to school in college that I started getting voices that said, well, maybe this isn't the path for you. But I always had people on my team that like made me believe. So high school, I ended up going to a boarding school, which was really hard. Like it was a decision that my parents let me do. went to Illinois Math and Science Academy, which is a boarding school in Aurora. So I didn't go to public school or anything like that. I lived in a dorm. It was kind of like a college-like experience because I just thought that might be good to see people from different cultures and different races and like to challenge myself. I knew I liked math and science, and I really knew that I had some sort of career that involved that. So my parents were gracious to let me go there. Did fine, made great friends. Then I went to college. And in college, as you know, you're like coming from a setting where you might be like the big fish in the pond, right? In college, you're just a fish. You're just a fish. So of course, there are certain classes that are like weed out classes that you have to go to. You know, the dreaded one is organic chemistry, right? You know, you do general chemistry and biology, but that organic chemistry, man, it rocked me. It rocked me. But the thing that kind of discouraged me a little bit was that at my college, I went to Washington University in St. Louis, which is really supposedly a very good school if you're interested in doing pre-med or whatever. So I was in the middle of my second semester of organic chemistry, and one of those tests I had failed, one of the first ones of the semester. So I'm a little sad, I'm down, I'm like, okay, I know what I'll do, I'll regroup, and I'll go meet with my pre-health advisor to just see how can I strategize. Like, so I'm coming in with a plan, and you know, I need a tutor, I need this, I need that, and the other. And that advisor pretty much said to me like, well, maybe medicine is not what's meant for you, right? So, I mean, it knocked the wind out of me. There's certain stuff that you remember along your path. That's a moment that I'll never forget, where it was somebody that didn't even really seem to take the time to learn of like my trajectory, like my history. They just took that one isolated moment and just said, you know what, Carl, maybe this isn't it for you. I thank God that I did not listen to that one voice. And that'd be a lesson that I would actually share for high school students and college students is like be very discerning of whose voices you actually listen to. And just like when we talk to patients, sometimes you need a second opinion. So I said, okay, I hear what you're saying, but silently I had removed that person from my team. I went to see another advisor. Thank God there were 3 advisors. So I saw another one that a lot of students raved about. And when I met with her, it was a completely different like narrative, a different conversation. She said, okay, you did have some struggle, so maybe this route didn't work. Maybe we'll go this way. So, you know, the path wasn't straight. It was more like a circuitous one, but you problem solve, you strategize how to get there. So I had that bump, but working with her and other classmates and, you know, just regrouping, I was able to finish that class, did okay, continued to do okay, and applied to medical school. I knew I wanted to come back to Chicago. I'm from the southwest suburbs, and I knew I wanted to be around for my parents and to kind of help still care for my brothers. I never stopped doing that just to be around. So I knew I wanted to go to a medical school close to home, and thankfully Chicago, you have a lot of options. So I was looking for a program that I knew highlighted like community medicine, being out in the community, like public service. So I was attracted to Rush, and actually backtrack. In my college career, I was fortunate enough to do a program known as SMEP, which is like a summer medical education program. That was a huge blessing for me because that was the first time I was able to see minority physicians and residents and faculty members. And that was one of the first moments I was able to see doctors who looked like me teaching me how to get to where they were and to kind of avoid some of the missteps that they had made. So I met some of the Chicago Medical School faculty through that, and fast forwarding again, that's why I was interested in Rush on top of knowing more about like their vision. So I applied to Rush, got waitlisted. I don't tell a lot of people that. I got waitlisted, so I'm just sitting here on pins and needles. I got into some other schools, but I really, really wanted Rush. So I just kept sending letters and emails and calling the dean and saying, you need to let me in here. And somebody heard my cry. So I get into medical school. I'm like, okay, great. It's going to be smooth from then. And it was not. Yeah, it was not. When I arrive, another thing I won't forget, I come to my medical school class. I sit in the lecture hall, and I'm the only black person in my class. I think it was about like 130 of us. So I'm like, is this a joke? Am I being punked? I'm sitting here waiting like, okay, what are the minority students? And it was just me. So moving forward through medical school, there was a whole other challenge that I had, which was really up here. So it was really like a mental problem, like imposter syndrome. So I started having these feelings of doubt. I performed okay. I was able to pass step one. Thank God I was able to pass exams and all that stuff. But when I got to my floors, like during my third year and fourth year, where judgment's a little bit more subjective, not just tests, but how do you fit into a team, I never quite fit as a black male in medicine at a kind of a predominantly white institution. I felt like a unicorn. Like people would look at me like, how do you get a coat? Who let him in here? Like what's going on? So that was always in the back of my mind, like, well, do I really belong here? Was I just some like quota that somebody was trying to fill, or do I really belong? So again, I needed more mentors. I needed to see more and more people. And there were faculty members at that time who were here at Rush, a cardiovascular surgeon, an internist, a family doctor, who really took the time to meet with me like quarterly just to see how I'm doing. There were upperclassmen. Even though my class, I was the only one, but the other classes, it was about maybe 5 to 10 per class. So they really created community for me and kind of were safeguards and kind of teach me the ropes and made sure that I didn't make huge mistakes. But really the big thing for med school was like just a mental hurdle to get over. It's like, okay, I feel like I have to represent all of blackness and not make any mistakes. And it was very, very hard. And I felt like it was kind of unfair because I didn't think like my other counterparts who may have been Asian or white, I felt like they didn't have that same sort of burden, but I did. But I made it, I graduated. And initially when I graduated, I thought I would never, ever, ever come back to the west side. I thought I would just go back out to the south side. But when I decided to do family medicine, lo and behold, I'm still on the west side. I trained over at West Suburban Hospital, which is a really, really fabulous family medicine program in Illinois. And I loved it there. It was like the opposite of what I experienced at Rush, because West Suburban Hospital, you serve the Austin community, which is predominantly African American. So I went from a setting where I felt like I was the only one and maybe no one really wanted me there, to being one of the few African American residents and everybody wanted me. I felt like I connected better with my patients. There was just this level of understanding. I felt like I built rapport. I was able to like really motivate patients and populations to make change. I felt for the first time a sense of pride, a sense of belongingness, and a sense of like, yeah, this feels right. This feels like where I'm meant to be. So that's a little bit about my path. So after I finished residency, I went back to the southwest suburbs near my hometown, and I worked at a Christian healthcare clinic to do underserved medicine. But then I felt a call to come back to Rush to help students who may have felt like I felt like they were the only ones. If we don't go back to those spaces, then how will it change? So I felt like this, not necessarily a burden, but I felt a strong like urging to go back to Rush to meet that need. And I haven't looked back since. I've been here for 2 years, and it's been very, very fulfilling and really just a joy. One huge difficulty that I had going through med school was pertaining to my rotation. So the first 2 years you really are doing book knowledge and taking tests and all that. That's fine. I did okay. But then when I hit the rotations, I found out that it was a little bit more subjective. It's like, how do you fit in with a team? How do people perceive you? And unfortunately, as a black male, for a variety of reasons, what you see in media or just whatever's portrayed from other people, or even just like living in a nation that has a strong history of slavery. There's all sorts of negative stereotypes that I feel like I have to fight every day and had to fight even at that time. I felt often prejudged by people. I remember a couple of evaluations that I had that, again, kind of knocked me off my feet. I did pediatrics, which is like, oh man, it's babies. What's the worst that could happen? And I often would ask for feedback because I like to go and do my work. And, you know, as long as I'm doing my work and I set expectations and you set expectations of me, things are fine. But I remember there was an intern that wrote in my evaluation for pediatrics that I'm not meant to be a physician. which I was like, how is this even possible? I mean, on what grounds is this person even making this? You know, I go to rounds, I participate, don't get everything right, but I'm active. I ask what else is needed to be done on the floor, so on and so forth. So I had to escalate that. I had to actually talk to my the Office of Medical Student Programmings about that. And lo and behold, this person had wrote that for several other students. But for me, that felt like a personal attack. I don't know where that came from. Again, I felt very kind of triggered or just prejudged again, just as a black student. It's like, well, what is it that I didn't do that this person did or did not do? There was another evaluation that was a little bit more subtle. I was on my neurology rotation, and an attending had wrote just 2 words. He wrote well-intentioned, which initially I thought like, okay, that sounds cool. But then I looked it up. I actually looked up the word. And well-intentioned means that you try, but you don't succeed in carrying out whatever it was that you meant to do. So again, I was like, on what grounds are they making these evaluations? So again, I had to think back to that one experience that I had in college about, okay, whose voice are you going to believe? In a sea of many other people who do see what I have, do see what I offer, am I going to let that win out versus the voices of few who look at me through a very narrow and sometimes prejudiced view because I don't fit into what you may typically see in the world of medicine, which may be an old white man. So I decided to keep moving, advocate for myself as needed, and continue to just work hard. So again, when I went to residency, that's when I started seeing the fruits of my labor. When I was really in a community setting, in a specialty that I chose, seeing that, yeah, this is where I belong, and I am a good physician, and that I know so because of my students tell me so, my patients tell me so. But more importantly, I knew that all along, that I had to believe it in myself first before anyone else did. So unfortunately, going through this path of medicine, you will face that in some form of fashion. You just have to remember, whose voice are you really going to believe? And if you need to, change your lineup, be discerning, and just have a team of people around you that will build you up when those moments come. So residency, how I chose a residency program is kind of similar to how I picked a medical school. I knew I wanted to do preventive medicine and community health and kind of be like the hands and feet in a community. So I looked for a program that would give me like broad spectrum training in family medicine, and if after that I wanted to narrow down my scope, then so be it. If I wanted the broadest possible reputable training as possible. So I found that at West Suburban Hospital, which is like stone's throw away from Rush. It's near the Austin community. So I love that because you get to pick which clinic you want to do your resident clinic in. So you can serve African American populations, you can serve maybe more affluent populations if you want to, or you can even serve a predominantly Spanish speaking population. So I picked the Austin clinic, which is mainly African American and Hispanic. And I love that because that's for the first time I felt like, okay, like my talents, who I am, my presence, I felt like for the first time it wasn't like I didn't feel like anyone was staring at me. You know what I mean? I felt like it was like, oh wow, there's a black doctor up in here. So I felt like it kind of gave me a leg up almost, like when I would be with my patients, it was just like a sense of understanding. Like I felt like there were a lot of barriers that were kind of already torn down. Like there were things that when I would talk with them, it was like talking to like an aunt or an uncle or a grandparent or a family member, someone that I felt like I knew for years. You know, so having that rapport as a primary care doctor is so key as you build relationships with patients and try to motivate them towards change. People won't change unless they trust you. So I felt like I was able to garner trust better than compared to some of my co-residents. They had a little bit of struggle with that because for some of them it was the first time that they felt prejudice, where there might have been black patients or minority patients that did not want to speak to them or did not feel comfortable surrounding them. So it was a very fascinating sort of change there. But nevertheless, it was great. I felt like I got good training. I felt like I had a good cohort of residents who were like-minded and shared that vision. It really did feel like family. So I loved it. Those 3 years were wonderful. Like, it was just good. I had to attribute a word to my path in medicine. I'd say belief. My faith is very important to me as a Christian. I feel like that has been a huge anchor to me as I and maneuvered through the pitfalls, the hills and valleys of medicine. And I'd say advice to students or residents or whoever, make sure you have some sort of anchor, because there'll be some things that'll kind of push you and prod you and make you want to give up and throw your hands up, but have some sort of an anchor, whether that is your belief, your community. For me now, it's mainly like my family, my wife, the patients that I have now, and more importantly, like my students. So I get to see future generations of students kind of blossom and evolve and find themselves. And it's really a joy to be able to feel like someone who initially I didn't think I would even get to the table where decisions are made or to train other people. It's such a blessing. So I guess belief, and then gratitude. Gratitude would be my other word